When it comes to confidence, sometimes the biggest changes start with the smallest details, and understanding your options can make all the difference. Joining us now is Dr. Johnathan Shih from Golden State Plastic Surgery, here to walk us through breast augmentation and clear up common misconceptions and explains what patients should know when considering their options. Dr. Shih, great to see you.
Hi. Thanks for having me today.
Yes, of course. I'm so excited to talk to you because I feel like a lot of girls are always having so many questions when it comes to breast augmentation. But first, can you please explain to me just an overarching view of who Golden State Plastic Surgery is and what you guys are all about?
Yeah, of course. So I'm Dr. Shih. I'm with Golden State Plastic Surgery. We're based out of Walnut Creek and San Francisco. It's myself. I do a mix of cosmetic and reconstructive surgery, mostly focused on the breast and body. My partner, Rahul Seth, he focuses primarily on the face and neck. And then we also have Dr. Rose, who's a cosmetic dermatologist, and Dr. Rose, who's a hair transplant surgeon, and Dr. Zhuang, who's a cosmetic dermatologist. And the four of us combined, we kind of make this group as Golden State Plastic Surgery. And our goal is really just to offer kind of like like an all-in-one, one-stop shop for, all needs, all things plastic surgery.
Yeah. Well, today we are going to focus on the breast augmentation. And like I said, this topic of conversation has come up many times, I think, between different girlfriends, different girl chats. So I feel honored to have you here to kind of just sort through all the misconceptions and answer questions. So first, what is one of the biggest misconceptions when it comes to getting a breast augmentation?
Yeah, it's a great question. One of the most common misconceptions I hear is that the results are going to look fake or obvious. Breast augmentation today has really shifted away from the dramatic changes that were popular maybe 15, 20 years ago in favor of more natural appearing and subtle results. Most women today are actually choosing smaller implants, with about 70% of them opting to go just 1 or 2 cup sizes up. And we're also seeing more demand for the newer implants like Motiva that are designed to mimic the natural contour of breast and look and move more naturally as well. Another misconception is that implants need to be replaced every 10 years. While that may have been true, again, in the past, the newer implants that we use today, they often last for 20 years or more.
Wow.
And so really there's no expiration date for implants, and so really the only reason to change them is when there's a problem or when patients want to change.
Okay, good to know. That is a big difference in thinking that you would have to get this surgery every 10 years versus spacing it out to 20 years. I think that is pretty cool how far along that's come. Who is a good candidate for this surgery? Yeah,
so the best candidates aren't just physically healthy. They have a good sense of, or a clear sense of, why they want surgery and what they're hoping to achieve. Usually, patients who seek surgery are, those who have been thinking about this for a long time, and this isn't just a spur-of-the-moment decision. The common reasons I see for wanting surgery are changes in your breast volume or breast volume loss after something like pregnancy or weight changes, asymmetry between the breasts, or just feeling like the breasts have never really been proportionate with the rest of your body. The consultation's a great opportunity to kind of explore those concerns and then translate those into a plan that'll meet your goals.
Yeah, incredible. Okay, well, you kind of just mentioned, the extension of how long these last, and I have to think that that comes from the type of implant now that is available. And I know this has always been a big conversation, this one versus that one. So where are we right now in the type of implant that you are using?
Yeah, so in my practice, I'm using a primarily silicone implant. There are silicone and saline options, and we could go, we could have a whole show dedicated to just, the different characteristics and, when they apply. But I think the most important thing is finding an implant that fits and is appropriate for your particular anatomy. One of the biggest mistakes that women make is coming in focusing too much on a specific implant size. Mm-hmm. And when you're when your mind is set on a size without really considering the, how it affects your anatomy, or how your anatomy affects the decision, you can end up with implants that don't necessarily match your frame, or results that don't really hold up over the long term.
Okay, yes. Well, I mean, there are so many questions when it comes to this, and you actually will be doing an event soon covering all the types of questions. So tell me about the event that you will be holding.
Yeah, so we're going to be holding a small educational event on breast augmentation May 26th at our Walnut Creek location. It'll be a relaxed, low-key event where you'll be able to see and compare different implants, learn more about the surgery itself, and then ask me any questions that you have. The event's going to be also, for people who are attending the event, you'll have an opportunity to schedule a complimentary consultation and, get special pricing on the surgeon's fee for surgery.
Yeah, incredible. And there's the numbers on the screen right there that you can call or text or even send an email to RSVP. And like you said, there is a special offer for everyone to have a consultation after they attend, and you have to attend this event to get that special offer. Well, thank you so much, Dr. Shih. We really appreciate you joining us today.
It's been a pleasure.
Yeah, thank you. If you want to learn more about Golden State Plastic Surgery, you can head to their website. That is gsplasticsurgery.com.